In a crowded medieval town, the striped pole outside a small shop meant more than a neat beard. Inside, one chair served trims, aching patients, and wounded soldiers. In many places, barbers did work, now divided between surgeons and dentists. Let's discuss 8 insane jobs of medieval barbers and how one trade sat between daily life and rough medicine. It begins with haircuts and shaving, the most ordinary work of the medieval barber. He cut hair, shaped beards, and scraped faces smooth. Styles hinted at rank and role. A neat cut suited a town merchant, while rough hair might mark a laborer. For monks and some clergy, the shaved circle of the tonsure showed a life given to prayer. Monastic rules in Western Europe took their form. In the chair, people talked and watched the street, so grooming kept social and religious lines visible. Beyond hair and beards, barbers were closely linked with bloodletting. Guided by humoral theory, they opened a vein or used leeches to remove what was seen as excess blood. Fevers, headaches, flushed skin, and many other signs might lead to a visit. Across France, England, and the German lands, town orders and medical texts mention this work. Wealthier clients could be treated at home, poorer ones on a stool in the shop. In both cases, the barber stood where written theory met bowls and blades. When injuries or swelling appeared, many patients were sent straight to the barber's knife. He opened boils, drained abscesses, and cut away dead flesh so pus could escape. Before cutting, he checked for heat, redness, and raised skin. 14th century writers such as Guy de Chauliac described these steps, but the barber decided at the bedside. Work was done without real pain relief, with helpers holding patients still. This shows how barbers handled the messy, hands-on part of care, while physicians often stayed at a distance. When bones broke, the same shop often dealt with setting and splinting. After a fall or a workshop accident, a barber examined the limb by sight and touch, feeling for sharp steps and misplaced joints. He pulled or pushed until it seemed straighter, then tied it to boards or sticks with linen bands. Some used cloth, hardened with wax, or pastes to make a stiff shell. Many people healed with slightly bent arms or legs, showing how trauma care relied on touch more than theory. Tooth pain brought yet another kind of visitor to the barber's door. Barbers acted as early dentists when they pulled rotten or cracked teeth that no longer responded to simple remedies. With metal forceps or hooked levers, they gripped the tooth and worked it free as quickly as they could. Rinses made from wine or herbs might follow. Records from English, French, and Italian towns mention tooth pullers in markets from the 13th to the 15th centuries. The moment was brief and harsh, but the first quiet night without pain could feel like a cure. When bleeding would not stop, cutting alone was not enough, and barbers turned to heat. They used red-hot irons or heated tools to seal vessels and close severe wounds. In grave cases, cautery followed limb removal. Late medieval surgical texts and early images show barbers holding glowing metal to open flesh. The pain and smoke were intense, yet for some patients, this step meant the difference between life and rapid loss of blood. Cauterising shows how often medieval healers relied on direct force. Some barbers even carried out delicate work on the eyes. For cataracts, a method called couching is used as a fine, pointed tool to push the cloudy lens out of the line of sight. Without real anesthesia, patients were tied or held while the instrument passed near the clear edge of the cornea. From the 13th century onward, Latin and Arabic writings describe this operation. A few people gained partial vision, but infection and blindness were common. These attempts show how manual healers tried to restore sight with narrow chances of success. At the far end of their work stood amputations, among the most serious tasks a barber might attempt. Crushed limbs, deep infection, or dead tissue after wounds sometimes left removal as the only hope. The patient was restrained. A band was tied above the injury, and the barber cut through soft tissue before sawing bone. The stump was dressed with cloth or sealed with a hot iron. Accounts from late medieval wars mention such surgery on soldiers. A few lived on as amputees, but many died, showing the limits of medieval surgery. Medieval barbers were far more than beard trimmers. One shop could tidy a monk's tonsure in the morning and cut off a soldier's leg by evening. If you want more unfiltered medieval life and medicine, hit subscribe and jump to the next video on your screen now.